constant. My husband makes fun of me. I was making stock. Barely, but yeah. I was just 21. Yeah.
Well, this
Project and everything came down here. There's meetings today.
And that, I mean, that would be on-site help.
Thank you.
Hey, did you get my email? That's what I have a feeling. I sent it to you 2 weeks ago. Okay. Yes. No, it's the ASM. It is. Okay, so here's a copy of it.
Okay.
Okay. And this is some, it's not all, but some of the data that I sent to you.
Oh, yay!
Yes, and I've got some other things too. But I'm going to be reading this during the public comment.
It's not me, she's coming.
They're always looking at this. It's always helpful.
Okay.
And that might give you a little
I
better.
want to get. How do I get rid of? Do I go to slideshow?
Oh, good. Oh, fantastic. Okay, good. Okay, but because pharmacies seem to be getting squeezed out is how they're feeling. I know. Absolutely.
The right arrow goes to the next one. Pass it up.
Yes.
Oh, okay.
Absolutely. Yeah. So read that, and that will give you a real good feeling of what's going on. Right. Okay.
Okay, great.
Okay.
Turn it off. So the camera's there. I'm worried about zooming in.
We need to keep yeah.
And we all appreciate that. But just so you know, there will be people out here watching down there. So sometimes when we do things, there aren't that many people to do.
But we know thousands all over the building.
Like they're either watching this or something about Tiger Woods.
Well, yeah.
Like chasing them around the bar.
Yeah.
you don't want always challenging to get along. Right, exactly. Right. The joys of modern technology.
What's about it? So.
When you're done.
So it's on.
Yes, that's what the last
I love it. Thank you.
I was more thinking of a note too. Since lectures is forward from the mind, otherwise there's such a crosswalk. Yeah, exactly. You're using this.
I just noticed the file.
Okay, good morning. On behalf of the Assembly Select Committee on Schools and Community and its chair, Assemblymember Tom Torlakson, I want to thank you all so much for being here this morning. As you all know, there's much more that kids bring to school every day than just their backpack. They bring their lives, their histories, their health. They bring their communities. They bring their families. So today's hearing, or briefing, excuse me, is going to be an overview of a new initiative looking into the connectivity between student health and their ability to perform in the classroom. And so we appreciate you all being here. Just to do a little bit of housekeeping so everyone knows, we've got our panelists who are going to be presenting, And then the last 30 minutes have been dedicated to have stakeholders come up and share their perspective, since we know this is an incredibly diverse field with many different aspects of student health and youth development that are included. And so Serena Clayton will be kicking us off in that regard, and everyone will have who would like to have an opportunity can have about a minute to come up and to share with the panel and with the folks in the audience. So with that, on behalf of the committee, I would like to introduce Ceci Echeverria from the California Endowment, who will be our first presenter.
Good morning, everybody. I am, again, Ceci Echeverria, Senior Program Officer with the California Endowment, and am thrilled to be able to work with the Select Committee on Schools and Community and with Assemblymember Torlakson on being able to present some of the work that our folks from WestEd and from UCSF have pulled together for exploration and discussion. So thank you. I'll start by sharing a little bit about the California Endowment and our interest in this work over the next 10 years. The main focus of our work is called the Building Healthy Communities Initiative. Moving forward, and our main vision is that healthy communities equal a healthy California. So what is a healthy community? And I'd like to just point to one of the main areas of work that we'll be doing over the next 10 years, which is trying to create places where children are healthy, safe, and ready to learn, is our main area of interest in the work that we'll be doing over the next 10 years. We'll be looking at work in 14 targeted communities. And we also will have a focus on state and federal policy and the impact on California. And there's 4 main systems that we'll be working on over the course of that time. The first is health systems that are family-centered and prioritize prevention. And when we say family-centered, I think that that can be interpreted in complementing some of the work that we'll be talking about today by saying that we think some of these services should be where families are and where children are. So schools become a central place where that work will be happening. We are looking to support schools that can promote healthy behaviors and act as gateways for resources and services. We've been exploring models for helping support that work. You'll hear about some of those models later this morning. And we've also been identifying the research base to help support this work through this collaboration with WestEd and UCSF and with the 2 other funders that help support this white paper's development, which are the James Irvine Foundation and the Hewlett Foundation. We're looking at human services that are family-centered and prioritize prevention. And we're also looking at the physical, social, and economic environments and the influence that they have on community health. All of those goals, we think, will wind up helping support the work that we're interested in doing. And one of the main goals that we're looking to achieve through this initiative is to increase student attendance. There's a number of those factors that will go into that work, but we will hold ourselves accountable, certainly in the 14 places and hopefully beyond through the rest of the state, to look at how to improve attendance and minimize the health factors that contribute to decreased attendance. So the shared vision that we have of health is complicated, I'd say. There's a number of factors that we know contribute to what a healthy community is, what a healthy student looks like. And we're looking at a number of the areas that you see listed here as contributing to that. So again, over the next 10 years, we'll be looking at each of these 10 elements and how they influence and support student health. There's a number of policy opportunities that we're also looking at, and we'll hope to continue that work with the Select Committee. We'll be looking at the opportunities that we currently have through the ARA, through health reform, through the Child Nutrition Reauthorization Act, and through the Elementary and Secondary Education Act reauthorization that'll be happening in the next few years. So we're interested in looking at how to leverage these federal opportunities to improve the health status of Californians, and again, looking at children and at school health opportunities in particular. So what I'd like to do now is go ahead and introduce the research team that helped pull together this paper that we'll be discussing today. First, I'd like to introduce Greg Austin, who's the Director of Health and Human Development at WestEd. He will be co-presenting with Claire Brindis, who's the Director of the Philip R. Lee Institute for Health Policy Studies at UCSF.
Thank you, Claire. Whoop. Okay, got to get. Thank you, Ceci. All right, we got to get this all right today. It's a pleasure to be here and talk to you about the project that WestEd and UCSF are doing together. We're calling it the California Education Supports Project. We'll explain a little bit the origin of that name later. It's jointly funded by the endowment, the James Irvine Foundation, and the, I always forget, it's the Hewlett. Our role in this project is to start collecting and disseminating data that shows the links between health and education, particularly in the California context. So we're really wanting to look at what data we have that shows these linkages that come from California schools and California students. And today we're just going to share some of that data with you just to highlight the scope and nature of the issues in the limited time we have, and talk a little bit about how we hope to contribute to the discussion about this issue and how we can do a better job of breaking down silos and linking health and education. So just to give you an overview, is everybody, was this passed out to everyone? Okay. This is the framing paper that we've put out to sort of summarize the current state of information. And this is just two statements that sort of launched the framing paper. And this whole discussion is that the health of California students has a direct impact on dropout rates, on attendance, on learning engagement, academic performance, and school district revenues. And we'll talk about each of those today. And our message is that by carefully coordinating where and how to provide health-related services, schools and policy makers can make a difference both in student academic achievement and in the health of students. And what we're really all about is doing this to ensure that we have a thriving, competent future generation of Californians, and we really can't lose track of that important message, really what's at stake in this debate. So this is just some of the points also about what the research says that we will talk about. And the overall picture is that health and achievement are mutually reinforcing and interrelated. And this is just some of the ways that occurs. So individual health and healthy environments contribute to better school attendance, engagement, and performance. And healthy schools promote connectedness. And connectedness in study after study has been shown to be powerfully linked to both positive health outcomes and positive academic and other educational outcomes. So that's really one of the areas that this connection, you see it over and over again, and it's really important we keep that in mind when we look at school improvement efforts. The third message, the way they're related, is we find over and over again in schools and students that health, behavioral, and academic problems are multifaceted and interrelated. So they're co-occurring in the same environments and in the same people. So the overall message then is that we really need to start breaking down these silos that historically have separated the health field and the education field and look at ways that they can work together to improve school environments and achievement. So what we've been finding too is that improvements in curriculum and instruction and governance have been the main focus of most school reform or improvement efforts. And while those are critically important and have made some great strides in improving performance and test scores, that in a lot of cases that they are simply not sufficient to turn around low-performing students in schools, because to fully benefit from these improvements, we have to make sure that schools address the growing health-related behaviors, barriers to learning, and create engaging and supportive school climates. So schools and communities must collaborate to address these external barriers to learning, because it's a very challenging issue that we all face. But it's also clear there's much that schools can do on their own to start improving the situation, but they need the support of policy at the policy level. So what do we need? What do we mean by student health? And we take a very holistic approach to it, and it's almost a synonym to well-being in general. And these are just some of the areas we're talking about. The first 3 points are what just a lot of people may think of when they first think of health. It's the more physical health area of illness, asthma, obesity, nutrition and exercise, dental and oral health, reproductive health, which includes teen pregnancy prevention, STDs. Then there's the whole area, social, emotional, and psychosocial area. So, and that's about risk behaviors such as substance use and violence, safety and bullying and harassment. In the broader area of mental health and stress, and positive development and resilience. And finally, we talk about environmental health. A lot of the discussion about health seems to be focused on individuals. What we really need to start doing is looking at how that environment is contributing to the individual's health and what we can do about it. And part of that environment is the toxic situation in communities, but also the poor environment in schools that help contribute to this problem. And often also part of the environmental strategies to promote health is developmental supports. And what the research is showing consistently over at least the past 20 years is that for youth to learn and to thrive and be resilient, their basic developmental needs first must be met. And that means their sense of belonging and safety, their mastery, sense of competence, and the meaning they receive from their experiences. So how do we go about doing that in the school context or the community context or any environment? And what the research is showing is 3 developmental supports, or they're often called protective factors, are really key. And those are caring adult relationships, high expectations messages, and opportunities for meaningful participation. And we'll be talking about those a little bit later. And those 3 fundamental supports have been found over and over again to be associated with both lower health risk behaviors and positive educational, psychosocial, and psychological and social outcomes, even among youth that come from very high-risk environments. So that's the goal of education supports, as we define it, is to promote learning by creating positive, healthy school environments, programs, and services that broadly address the physical, psychosocial, and behavioral barriers to learning, meet the developmental needs of youth, promote positive school climate, connectedness, and learning engagement, enhance teacher satisfaction and retention, and foster healthy physical facilities in schools. I just want to add that you may be more familiar with the term learning supports. One reason we are talking about education supports in this project is because of we feel the need to highlight the issue of teachers and their needs and how they intersect with the students' health needs, and we'll talk about that a little bit later. So this is really a holistic approach to success among students and staff. So now let's talk about look at some statistics about how really health impacts various educational outcomes. So we'll start with attendance. So asthma is the leading cause of school absences due to chronic conditions. And I just was looking at a statistic. I think it's 1.9 million absences, missed days in California in 2005 alone that were due to asthma. And nationally, 51 million school hours are lost per year due to students' dental health issues. 6% of students nationally have missed school in the past year because they were afraid to go to school or afraid to be at school. So going to or from school or in school. And in California, we find that 22 to 23% of students miss school because they fearful to go to school because they're being reporting bias-related harassment. 8% of 11th graders report missing school at least once because of substance use, and 58% of heavy substance users skip school or class at least once a month, compared to 10% of non-users. So these are just examples of the many ways that health-related factors lower attendance in California schools, and if they're not at school, they're not going to learn. But even if they're in school, how are we? They're not going to learn if they're not ready and able to learn, and if they're ill, tired, or hungry, if they're unable to concentrate because they're restless from lack of exercise, they're intoxicated, fearful, stressed, emotionally disengaged. All these factors are going to influence their ability to learn. And that's at the individual level, but when you look at the environmental level, the lack of safety, of the existence of violence, crime, and bullying, and just social disintegration as a whole, affect the whole campus. It affects how all kids can learn and how teachers can teach. So, and finally, a healthy school climate promotes school connectedness. So we've talked about students, but let's now talk about the teachers. And student health problems are a major distraction to teaching and teacher satisfaction, and they're a problem that most teachers simply are not trained to deal with. So it interferes with the whole process of education. But when research has been done on why teachers stay or leave the field, one of the factors that emerges most strongly, as powerful as issues as money, is the working conditions. And a lot of those conditions that are highlighted in the research are aligned with those same developmental supports issues that we were talking about with kids. It's factors involving the collegiality, the relationships with staff. It's about the expectations for performance at the school. And it's about having opportunities to meaningfully participate at the school. So we see this same alignment with teachers as with staff. And given that 22% of teachers leave within the first 4 years, this is really a huge problem in trying to turn around low-performing schools, because if we don't have qualified teachers who stay, if we're constantly having to deal with teacher churning and retraining, we're not going to make progress. So we need to look at this area holistically as well. And of course, the most logical, the last way it impacts is that unhealthy environments are just going to affect teachers' health as well. And if they're not in school, they're not teaching and kids aren't learning. So with teachers, our 11% of referrals to the Division of Occupational Safety and Health in California. So these are not small issues at the teacher level either. So these are then just some statistics that sort of summarize some of the overall costs to schools in school budgets that are related to these factors. So the economic cost of illness in California has been estimated to be $670 million annually. In the lost cost from ADA related to asthma alone is $33 million. Nationally, substance use it's been estimated to cost American schools $46 billion annually related to truancy, special education, disciplinary problems, disruptions in the classroom, teacher turnover, and property damage. And then there's the unestimated yet costs related to the hiring and training of teachers to replace those that leave. So this is just a quote to illustrate that this isn't a new problem. This has been recognized for at least 20 years when the Council of Chief State School Officers in 1998 pointed out that growing numbers of children are coming to school with health-related problems that impede their learning, and many are engaging in unhealthy behaviors that sap their motivation to learn and threaten their future. And that on that slide is also just an example of the many studies that have highlighted this link between health and education. So it's not a new problem. but it's a growing problem that they recognized 20 years ago, and it has continued to grow because we really are not addressing this issue in a holistic, in a serious way. I've already highlighted the issue of school connectedness, and this is a quote from what I think is one of the most interesting, important studies that's been done in a long time about school reform. It's from the National Research Council. It's called Engaging Schools. And what they concluded is that the fundamental challenge to school reform is creating an engaging environment and providing the supports needed to learn. And that whole book really maps out a program of school reform that aligns with health and development of youth and shows these connections. And when we look not only in this study, but study after study about what promotes school connectedness and learning engagement, the consensus includes that they're caring teachers and strong relationships, high expectations and involvement that empower youth. So those 3 developmental supports, they call them different things, they emerge in different ways, but they're always emerging in that literature. Then addressing the non-academic needs of kids holistically and creating strong ties to family and community. So now we'll look a little bit more detail of some of the research that's been done about the linkages. And in California, we're fortunate to have 2 resources, the California Healthy Kids Survey and the California School Climate Survey. And I guess I should note that I have a bias on these because I direct those 2 projects. But they are considered by the federal government the gold standard in the nation for being able to provide schools at the local level with data about health in their school climates. So we're then able to analyze this data to really start looking at how these things impact performance in schools. So this was a study done by Tom Hansen several years ago when the study just began. And what he looked at is how improvements in California test scores varied over a year in relationship to the health indicators in the California Healthy Kids Survey. And what we found significant improvements in test scores in 1 year that were related to the level of physical activity, breakfast consumption, school safety, and caring relationships at school. So, and high expectations. So, the more that schools had each of these 5 factors, the more their test scores improved over the year. The corollary then was the lower the substance use, the lower the theft and vandalism, and the incapacitating sadness that students reported. Also, the more their test scores improved. So we also find consistently that issues of asthma affect achievement, and with 25% of U.S. public schools have indoor air quality problems that are asthma triggers. And one study has found that classroom ventilation is significantly associated with math scores. Another study found that children with poor oral health or poor general health are 2.3 times more likely to report poor school performance even after adjusting for socioeconomic factors. Here's some more data from the Healthy Kids Survey. Study that we're just wrapping up found that the lowest performing California schools are characterized by poor health supports. Consistently, they have higher violence, crime, harassment, victimization, and truancy, and they have lower perceived safety, developmental supports, and school connectedness. And it's almost a stepwise progression that as performance at the school level decreases, the more you have these problems. And health risk behaviors are consistently linked to poor school indicators. So heavy substance users in California are much more likely than non-users to report poor grades, poor connectedness, higher truancy, and also more violence, delinquency, and depression. So here's another example of that clustering effect that occurs. at the individual level, that kids who are having one problem tend to have multiple problems, and so you can't deal with these problems as silos. You really have to deal them as a whole. And a recent study that was done in schools in LA Unified found that peer victimization was estimated to account for up to an average of 1.5 letter grade decrease in an academic subject across middle school years. So how does health impact the achievement gap, which Superintendent O'Connell has called the major priority to address in California education? And it impacts it in a number of ways. So outdoor air pollution has been estimated to explain 10% of the 20% difference in achievement test scores between African Americans and white students. Healthy Kids data has shown that students in predominantly Hispanic and African American schools are significantly lower performing, less safe, less connected, and have fewer developmental supports than their peers in white schools. So that's at the school level. And then we look at how student groups vary by race and ethnicity, and we find the same thing is true. So there's not just an academic gap, there's an education supports gap, there's a health gap, and we have to deal with it together. And I think one of the reasons this is particularly prominent in the achievement gap issue is that these education supports provide what is missing in the sort of nested inequalities of many minority students in California. And finally, how does health impact dropping out? And again, here's another example of how they are mutually reinforcing health and education. So the economic loss to California alone from one cohort of dropouts is $46 billion. So this is a huge cost to our schools and our communities and our state. And lack of student engagement is time and time again found to be one of the most important predictive factors of dropping out. And when we look at California continuation schools for high-risk youth, or youth at high risk of dropping out, we find that those that are actually beating the odds academically and are doing better than one would expect given their population and their student enrollment are characterized by having more learning supports. Not by the other resources that you would find at schools, but by these education supports. So, and then youth and that's sort of a consistent finding. It's almost a continuum, a parallel continuum of risk of disengagement in lower health indicators. So as kids become more and more disengaged, they have lower and lower health indicators. And youth who drop out also report significantly more involvement in substance use, violence, and other health risks in California. So what is the health status of California students? To that question, I will now turn to my colleague, Claire Brindis.
Thank you, Greg, and I'm also very, very pleased to be here and thank all of our foundation support for bringing this opportunity to all of you to really be thinking about how can the data be used by each of you in your own communities to improve the health status of young people. We as researchers come to the table excited about the fact that now we do have some data to really reinforce what many of you have experienced over many, many years in terms of recognizing the problems of young people. Secondly, that we recognize this as a life course issue, because if a third of California's youth are obese today, that means that as they get older, there are many health problems that they will be facing as adults. And it's really important for policymakers to recognize that investments in children and youth really has a payoff not only for their health and their educational status, but also for lifetime health conditions and well-being of adults in California as future taxpayers. Greg's done a great job of presenting to you some of the data just to reinforce
asthma is a very prevalent problem. We also see that there we are. The fact that as young people get older, that is, that when they're in the 7th grade, they feel more connected. As they get older in the 9th and 11th grade, they become less and less connected, and as a result, experience many of the health conditions. Many of our youth feel really unsafe at school, as well as having a number of mental health issues and depression issues that really interfere with their success as students and as interacting with their peers in a healthy manner. Greg has mentioned to you also the role of teachers. We look at staff here not only as teachers, but also as school nurses, as well as the principals, as well as the janitors. All of the staff in schools recognize the variety of health issues that young people experience. And while teachers have been asked specifically about how does the health of young people impact your student body, oftentimes they'll say that it is actually around issues of depression, bullying, as well as substance use that really interferes with their cognitive ability to be really good students. And we know that, again, there's a cluster of these issues. And perhaps you and I, as we were growing up, we were bullied in schools, but never recognized the relationship between bullying and how that impacts your self-esteem, your sense of safety, and how that spills over into your capacity to being a really good student. Teachers also recognize that health issues really interfere with the attendance issues, but also the presence issues of young people. So what is happening in schools? And clearly I want to clarify that our research teams are not here to blame schools, are not here to blame teachers. In fact, schools really become the site where many of these issues can really be dealt with in a very proactive, preventive manner. We know that schools are experiencing a number of significant budgetary cuts. School nurses face significant budgetary cuts. And so together, even though there may be champions among you to improve the conditions for young people, the reality is of what to do with more problems and fewer resources. We also recognize that health in the past has not been recognized as an important ingredient in health improvement, in school improvement plans. And so part of our concept of this concept paper is how do we begin to marry these concepts between school, education, success, well-being, as well as the health aspects that contribute to them. Schools often find themselves having to deal with exams and being sure that young people have an opportunity to do as well as possible. But clearly, the school settings are often places where there is very little attention being made or paid to coordination of care or having a very fragmented approach. It's almost as if the problem or issue this year it could be obesity, last year it could have been drug use, next year it could be tobacco. It's almost like adults have attention deficit disorder of the problems. And yet we need to recognize that many of the young people who are experiencing obesity are also experiencing asthma. They're also experiencing mental health issues. So we need to look at young people as a whole and also recognize a number of the learning disabilities that many young people have. Another issue about what's happening with schools is the fact that many of the school student services and support services and resources that are there at the elementary school are not there as a young person matures and moves into and transitions into middle school or junior highs and high schools. So the question really is, how do we as a community come together to champion the importance of continuing those early investments? There's always the upfront investment of the 0 to 5 years, but the reality is we need to continue to make those investments, and schools are a place where we need to be thinking about how do we improve coordination and also how do we really provide health services when oftentimes teachers and others at schools feel really torn about all of the agendas that they have to cover. So while we have been dealing and thinking about how do we contribute to where we are in California in the 21st century, I want to underline this concept of a holistic approach that focuses on both the individual student, the individual teacher, but also recognizes the environment in which the student and teacher are interacting with one another. And also this concept of school supports, which is the connectivity, it's the relationship building that has been shown to be so protective of young people. And also, how do we assure that there's positive youth development and proactive commitments to prevention? So in this scene, it really takes a school, but it also takes a number of other villagers to really bring up young people in our society. And here we know that it's a shared responsibility, and there's a need for political will around these issues. So while schools may be at the middle, in the front of this, there's also the importance of bringing the healthcare providers, whether they be the school nurses, school psychologists, other health providers that may be engaged with young people in the community. There's also a tremendous need for media to play an important protective role, as well as other community agencies, parents, families, employers who give their families an opportunity to attend some of the activities that students need, as well as the faith-based community and government agencies. So we do not see this as an issue that can only be solved by schools. We really believe strongly that we need a joint effort and a joint commitment to young people and to the future of California. When we think about the community factors that schools face when they're dealing with the young people who are affected by a number of issues that are going on in the school, in the home environment or the general community environment. And that includes things not only deeply seated issues such as poverty and stigmatization and marginalization, but also issues such as lack of community social capital, as well as inadequate or poor health insurance. And we know, again, the relationship between healthcare access and the abilities to really have the needs of young people attended to. Whether there are healthy grocery stores that allow for young people's families to be able to access fresh fruits and vegetables is as important as an issue as whether there is safety in the school classroom. So we need to be thinking about dealing with both of these issues or multiple issues simultaneously. We also know that schools can make a difference, and we're here to affirm schools as well as the individuals who work day in and day out to do a good job for young people. We know that data is extremely important in terms of young people having adults who care enough to look at the profile and not be like ostriches where you put your head and bury your head, but to really face what is the profile of my school? What is the profile of the health conditions of our young people? Are there ways that we can use available resources in a more positive, proactive way? For example, in the area of asthma, there's been a lot of research that's been conducted that really demonstrates that if you think about things like changing air filters in classrooms, or if you work on things like, is the bus idling by the window of a classroom? Are there little pets that are being kept in classrooms that are perhaps contributing to the asthma conditions of young people? So we need to be thinking about what are low-cost approaches and that are doable approaches that where schools can make a difference, as well as thinking about how do we change so that, for example, we have more water access in classrooms, in school settings where teens can buy water versus sodas, or where young people have access to high-quality water in the drinking fountains, as well as access to good nutritious food in school cafeterias. All of these factors contribute not only to obesity, but also to issues such as learning concentration. We also know that schools can make a difference in terms of having a better connectivity between the school teacher and the student, or the individuals who are surrounding the young person. I tell the story of a young woman who was adopted by a family, and she had a number of problems going through foster care, and her adopted mom once asked her, so what difference did it make? What really made a difference for you in terms of being able to graduate from high school today? And the young woman actually started making a list, and on that list there were about 60 people, and it ranged from the person who helped her to cross the street safely in the morning, who would say hi to her, as well as the janitor who would look out for her, as well as the school secretary, as well as the teacher, as well as the school psychologist. So there were a number of people, adults, who are playing a meaningful role, who can play an important role in terms of connectivity and making young people feel positive about coming to school. That is not an expensive price tag. That is our reframing of how do we use adults and encourage them to be in meaningful relationships with their students. Another issue really is around adopting education support strategies as a state priority. So we really need to be thinking about educational support strategies as part of school reform, as well as school climate issues and school climate supports, as well as incorporating it into teacher training and professional development. The issue of having data, the data that Greg and his group at WestEd has available around school climate as well as school behavior of students, is extremely important, because we need to be able to use the data to find the hot spots in our state where additional resources need to really be targeted. And finally, we need to be thinking about how to use data to identify best practices, because even in the poorest community, even in the poorest school, we find that there are those positive deviants, those individuals who are making a great difference for students, and we need to learn from those individuals who are making it with their students, successfully graduating them so that they can go on with school or other kind of vocational training, and identify that even under quote-unquote poor circumstances, there are wonderful lessons to be learned and lessons to be shared. Another area of policy where policy can make a difference is really supporting joint use agreements that encourage the school community partnerships and use of the school site to deliver services. And this is not just for students, but also for their families. So is there English as a second language being taught, encouraging Latina families and Latino families who may feel very nervous about coming to school sites, but through the ESL class that's taking place at the school setting, they begin to see that they can play a partnership role with teachers. Is the school building open after hours? Are there times where other community-based organizations can use the school as a safe place to provide their services? And clearly, we would love to have additional funding for helping to decrease so many of these silos that have occurred and have been created through some of our funding fragmentation. So how do we bring education and health together, but not just as a universal, but also taking into account the special tailoring, because communities in the Sacramento Valley versus the communities in Fresno, Los Angeles, Humboldt can be quite distinct in the way that they need to be able to use local resources. And we need to tap into local expertise around how to use those resources in making wise decisions about how to use resources. And clearly, I want to make one more plug here. I've been a long-term proponent of school-based health centers, as well as the role of school nurses and other health professionals, and even using the school as a place where you can sign up for health insurance, for example, for the Children's Health Insurance Program in California. So there, again, the school as a hub, but also a place where local community agencies can work in partnership with the schools. To finish my remarks, I want to say that in our project, beyond the concept paper that you have available, we are really working on increasing awareness of these issues. We're going to be developing a series of briefs on a variety of different topics. We're going to be trying to work on identifying the barriers that have resulted in preventing us from implementing educational supports that we've been talking about, and then really working to promote dialogue regarding effective strategies. What are the ideal models, but also what are some of the low-cost options, as well as middle-cost options and higher-cost options? I call it the 3-bear model in terms of developmental supports, but also increasing access to health care. And really, what are the strategies where we can get the most bang for the buck, and hopefully bringing together issues like healthcare reform as well as school reform as opportunities to bring a very strong commitment to prevention and a change in our political will around young people who represent really our state's future. Thank you very much.
Good morning. I'm Barbara Cronick, and I'm the Director of Support Services at Sac City Unified School District. And I'm, like everyone else here today, I'm very happy to be here this morning. I'm excited about the opportunity to address the importance of health and its impact on the success of our students. And in a moment, I'm going to introduce two people who are going to tell you about a school-based health clinic that we have opening up in Sacramento. As Director of Support Services, I'm only too aware of the issues facing our students and the barriers to reaching that success. In our district, Sac City Unified School District, we're an urban district with 48,000 students. And in our district, we have 19 family resource centers. And those students who are involved in those resource centers are lucky to have the additional support services. But we need to remember all the other students who don't have access to physical, social, and emotional supports. And with the increasing health needs of our students and the decreased funding of school nurses, we must be mindful of how we move forward to meet the needs of our students, both in practice and in policy. In Sac City, we are very excited about the opening of our very first school-based health center on the campus of Hiram Johnson High School. This has been a long journey for our district, and those involved have experienced many bumps along the way. And without the vision, the passion, and the perseverance of a few people, we would not be talking about the upcoming opening of this clinic. I'd like to introduce to you two people who will tell you more detail about the school-based clinic and its importance to our students and to our community. Rich Civitanov is the principal at Hiram Johnson, and he's someone who really understands the importance of providing supports to our students. He has been with Sac City for 23 years as a teacher, a vice principal, and a principal at elementary and secondary, so he really does know the kids. Since he became principal at Johnson, he has been there every inch of the way to make sure that all the pieces are in place. And the heart and guts behind the center is Pauline Tracy, who has been working on this clinic for the last 8 years, since she became a school nurse with Sac City at Hiram Johnson. She never stopped trying, even when it appeared that the dream of opening a clinic was over. Nurse Tracy, as she is affectionately called, is a school nurse, a public health nurse, and a family nurse practitioner, and an overall wonderful person. So I'd like the two of them to share with you their story about our clinic that's opening up.
Thank you. My name is Rich Civitano, and I'm fortunate to be the principal at Hiram Johnson. I'm coming in at the end where, though I've been here, this is my second year, and they have been having this battle to open this center for about 9 years. So, and I would echo what she's saying. Without Nurse Tracy, this wouldn't have occurred. As an educator for a long time, as a principal, I always thought my job was really to improve instruction, to work with my teachers. But as time's gone on, I've realized that it's really a very minor role. As a principal, there have been tough budget times. And one of the things that I have done, and I don't feel very proud about it, is that when cuts needed to be made, the cuts were, let's get rid of a nurse. And what I found is the one thing that we could really have an impact on our students was by looking at nursing services and offering programs for our students. I have a student population of just under 1,900 students. I'm a high minority school. I am a school that has about 84% Title I students. My students are the most needy. They live, some of them 7-8 miles away from my campus. typically do not have transportation, do not have access to resources that they need. As an administrator in schools, we do screening in elementary school. We do screening in middle school. But after we screen for health, for issues of vision, or maybe sometimes they'll do teeth, someone come on to do examination, not much occurs. That's where we stop. At Hiram Johnson, what we have found is that we have used all the resources we have available to us to find out what the major problem is. As I looked at this document and went through the results and heard that, I can put names to those kids, unfortunately, who are the ones who do not have good health care. Those that come to school rarely, many times inappropriately dressed, many times with issues of poor dental care. It's a battle for our students. And I think we at this school have tried to find ways to improve the health of our students. We talk about an achievement gap. There is a big achievement gap between many of our minority populations, but there's also an attendance gap. We look at our attendance. Our school runs an attendance of about 92 to 93%. District mandate is 96. But my attendance rate for African American students is in the low 80s. They seem to be students who, in addition to having the academic issues, there's other issues that impact them. The ability to have contact, have access to medical care. This health clinic is just the last step in a lot of things that we have been doing at that school. We have programs on campus to deal with the issues of the obese students. We have put together programs by our students to do things about healthy choices for foods. We know those are issues we need to address, and we are addressing them. My charge as I look at it today is that I need to improve the environment for my students, not just at school, but at home. And one of the things we can do is maybe to educate our parents. And we're hoping that this clinic will provide an opportunity for us to get the parents in so we can share information with them. Too often, our kids are overweight, and many are basically starved for good food. We try every opportunity possible to encourage good eating habits. We have made connections with milk companies to do got milk campaigns to encourage our students to eat breakfast in the morning, and it had a major impact on our kids. When students are testing, we provide them breakfasts cooked by the staff to encourage them to eat healthy. I thought it was kind of a joke when we'd send home a letter to parents before testing saying, please make sure your kids eat before and have a good night's sleep. We take it for granted that that's going to occur. We know that doesn't occur. We look at our students, and this last week before Thanksgiving, my students were in a pretty bad mood because they knew, many of them knew, that during those 5 days off, they weren't going to get the food that they are normally used to. I lecture about this a lot to my teachers, and they will tell you it's a lecture. Long discussions about what we need to do for these students. And I think it has become my main focus. I didn't realize walking into Hiram Johnson that I was walking into this clinic, but it was something that I accepted immediately. We have done everything we possibly can. I'm not doing everything she needs all the time, but doing as much as we can to promote this concept. We're promoting our school as a community center. We try to do that by bringing parents in, bringing sources in to talk to our parents, teach our parents. We brought the H1N1 clinic on our campus as a way to reach out to our community and tell them how important we look at health is. It's something that we know that has to be improved. If we're ever going to tackle the achievement gap, the academic gap, we need to first tackle this. I want to share, I've been fortunate to be at this school, and they've done a lot of things, but the main force behind this program has always been Nurse Tracy. And I feel very fortunate to be there, and I look forward to the fact that in just 8 days, we will after 9 years, we will finally open the first health clinic in Northern California, a school-based clinic. So please let me introduce Pauline Tracy.
Thank you so much for having me here. It is really great to be here. On my way in, I was walking on the site, and I noticed a sign that said Hiram W. Johnson Island, and I thought this was so appropriate. It's going to be a good day. Ladies and gentlemen, you're probably wondering why 9 years. Well, for the 9 years I worked hard, and I had several sponsorships that just went north, didn't work out. And because of reasons, financial and other reasons that came about, we were not successful. And then approximately 2 years ago, I finally spoke to a doctor, and I think he's well known in the community, Health for All, Dr. Akita, and he decided that he would sponsor us. And so that began our journey forward. And today we're here on the 8th. We will be opening the clinic. But when I first started in 2001, I immediately noted that something was wrong. Something was wrong. The types of students that I was seeing, it was impossible to be able to treat them as a school nurse, per se. It was somewhat frustrating for me also because as a nurse practitioner, my scope of practice was somewhat wider, but I was sort of, in a way, stagnant as to what I could do for the students. Referral was an option, but as you know, sometimes you refer them out and they're never seen on the outside because, again, because of transportation or other reasons, they just didn't go. So it was kind of frustrating for me. And so at that time, there wasn't really a place for school nurse on the Hiram Johnson campus. I was stuck in one little room, and I had a bucket with a bottle of bleach and a little bed, and that's how I started out. And I started searching for a room somewhat bigger where I know that I could do everything that I could do for these students. And finally, in 2006-07, I came across this building that appeared to have been a clinic that was never used. And at that time, the other principal who was there said, why not? And that's how it all began, and that's why I'm here today. So it was a long road, but it's well worth it. It's well worth it. All during this time, I had people that were very supportive, such as Serena Clayton, who's sitting here. She's been with me for over almost 10 years. She's known me, and she's been there behind me, the guiding force, encouraging me to move and letting me know that it'll come. It'll be successful one day. Just don't give up. It's coming, and here it is. So, why a school-based clinic at Hiram Johnson? Well, one of the things I was seeing was access. Students could not have access for one reason or the other. Either they couldn't find a doctor, they didn't have the insurance, they didn't have transportation, several reasons. Their parents weren't able to take them, just a variety of reasons. We wanted to increase access. We wanted to make sure that students get the best health care, and we also recognize that when a healthy student means better learning and success. And so that's one of the reasons why Hiram Johnson is having this school-based clinic today. Barriers that we saw was that the public, lack of knowledge about the health problems as far as adolescents is concerned. Family members really don't know what's going on. So, as Mr. C said, we need education around adolescent growth and development and problems that the adolescents are facing. There are some misconceptions about what school-based clinic do for adolescents. Again, those misconceptions usually get cleared up as soon as the clinic comes into effect, but we still have to deal with that. What are some of the barriers that Hiram Johnson has noticed that families face? Well, first of all, a lot of families do not use the insurance coverage that's out there. It's out there, but they're not taking advantage of it, either because they don't know how to access it, they don't want to fill out the paperwork, or just unfamiliarity with how to go about getting it. Transportation is a very big problem for our students. Parents don't drive. Parents do not have a car. If they have a car, it's a one car. It doesn't work. They don't know how to take the bus, or they don't have the finances to take the bus. Language barriers. They don't speak English. They're afraid to go out there and be turned away. It's embarrassing when you go somewhere and you can't speak the language and you don't know what's going on. And sometimes it can be, some individuals can make it difficult for people who do not speak the language. There's also knowing they don't know how to find the facility to provide the care. Believe it or not, they don't know how to locate it. They don't have the resources. Fear of the system, that if there's, let's say, illegal, that they will be documented and turned away or be arrested. And sometimes they tell us that the system is quite impersonal. It is not very feeling for their needs. One-parent families is another barrier. They live with grandparents. Grandparents are often sick, disabled, in wheelchairs. Grandparents cannot take these kids to the doctor. So as a result, their appointments are not kept. Poor role models. A lot of our children have no role models. The parents sometimes are in prison or newly out of prison with no resources. Or they have no brothers and sisters because of the fact that perhaps the brother or sister was killed in a gunfight. These are things that they have to deal with. Cultural beliefs. Many of our cultures believe that their illnesses are private and they can take care of it themselves, and there's no need to go to the doctor. They have their own remedies. Communication is very difficult. Oftentimes, when you try to call home to get a parent, to inform them about what's going on, or just to talk to them, to arrange a meeting, etc., the phone is disconnected or the phone number is wrong. Another problem that we face, another barrier, is when we send information home, we try to send it in the different languages. But for some reason, the student either doesn't give it to the parent, or the parent gets the information but doesn't read it. So these are just some of the barriers that face us at the moment at Hiram Johnson. So what are some of the health problems that we're seeing with the students at Hiram? Well, there has been a dramatic increase in the number of asthmatics. This year, what we know of, this is the information that we get on the emergency cards. There's approximately about 160 kids, and as Mr. C said, we have approximately 1,800 students. When kids are supposed to be carrying inhalers, you asked about the inhalers. They don't have an inhaler, or it's at home, or the inhaler is outdated, unusable, nothing in it. Increase in the number of obese students. We're seeing a lot of obesity among our students. And I mean really obese. We're talking about 15, 16-year-olds that are 300, almost 400 pounds. Coming to school. Again, the dressed improperly. Some of them are on oral medications or other insulin, IM, etc. And some of them have been to the doctor but are not keeping up with appointments. And it turns out that when you see these students, many of them, the parents are also obese. So it's like a familial tendency in the family. And it tells us a lot about their nutrition. Again, we need education for both students and families. Increase in the number of diabetics. We're seeing a lot of that. Right now, in my area, I have 7 diabetics that I know of that I'm taking care of at school, and that's insulin dependent and also oral medications. And as you know, teenagers have difficulty admitting that they're diabetics. So I have to be on them like white on rice at all times to ensure that they're taking their meds, they're doing their blood glucose, etc., and that the family knows what's going on, they're keeping their doctor's appointment. Very difficult. Mental health issues are another big thing. Lucky for us, we have an integrated support services on Hiram Johnson. So when we come across the mental health problems, we can do referrals to the health integrated support services, and the kids are seen immediately. We have some wonderful social workers and other mental health workers that are there. We find that students will get sick on the weekends at home, and they will wait and come in on Monday morning for me to see them. Why? mom and dad didn't have time, or they don't know where, they don't have a doctor, or they don't have the insurance, or the insurance ran out, or they just had emergency insurance, or the paperwork was not completed. These are all different things. Or they just wanted to come in and see me because they know they'll get good care. A huge number of our children right now have cavities that I can't describe to you. They are unbelievable. I mean, it's just the outer rim of the tooth when I look in their mouth. And so this interferes with their learning and their ability to learn. They're in class and they put their head down, what's wrong? And when they open their mouth, it makes me cry sometimes because I could just imagine the pain. And when you ask about seeing a dentist, oh, it's been years since I've seen the dentist. They don't even have a dentist. Or the insurance ran out, and so they no longer have coverage. Or mom is not home. She has to be at work, so she can't take me to the dentist. It's just unbelievable. Or another big one is the transportation, of course. We don't have transportation to take. And what about going to see emergency room? Well, they don't like to go to the emergency room, and I can't so blame them because they have to wait 45 hours to be seen, and they sit there in pain. So with all of that, what are the benefits of having a school-based health center? Well, with the school-based health center, we are there. The students are there. We are providing for their needs. We have them. We don't have to go out and look for them, and they don't have to look for us. We can service them. It's safe. It's very safe for them because they know me. They know the environment. If they have sensitive issues, they can come and talk to me. If they're depressed, they know that I'll refer them to someone who can help them. If they're doing substance abuse, they know also that they'll get the help they need. With the school-based health center, we are helping them, we're supporting them, we're identifying and addressing health, and we're keeping the kids in school so they can learn, so they can become successful. We also support family members because what we're doing is instead of family having to leave their workplace to come and pick the kids up to take them to the doctors, the kids can go immediately to the health center and get the care that they need. Okay, so we're providing really good care for the students, and we're also strengthening the connection between community and school. So, high points of this: students perform better with better health care. And when they're healthy, they are more ready to learn. And it's cheaper, it's more cost effective to have a school-based health center on base. They're a very captive audience. And we know that offering health care at Hiram Johnson, more students will get the care they need, and they'll be able to concentrate on their studies, lower the interdisciplinary problems, and increase their academic success. I thank you.
Good job.
Thank you. My name is Toni Triguero, and I'm a legislative advocate for the California Teachers Association. And first, I want to say ditto to everything that's been said before me. And I don't want to repeat myself, but for an individual that represents teachers, this is not new information for us. And we are delighted to have a room full of people who share our concerns and our issues about student success. Many of the issues that you've raised have been recognized by teachers for many years as barriers or impediments to student success. Just briefly, I want to tell you how our organization of 345,000 members in this state operates, and we do include in our membership all the litany of student support service staff. So we include school nurses, school psychologists, speech therapists. We represent all of those in our arena. 4 times a year, 900 elected teachers come together and draft policy that allows us to take positions on various bills. And that policy drives our organization from the ground up. And our policy starts with access to prenatal services for all Americans, the importance of early childhood development and education services provided by certificated personnel for all children regardless of income. We also believe that adequate nutrition has a direct effect on a student's ability to learn, which it's been documented before you. We were an organization that was happy to support the changes that were made legislatively about school lunch programs and the quality of foods available on campuses, and that they be nutritionally sound, appealing, and affordable, and that food and drink served to students should be free of harmful chemicals. We also have been supporters of a curriculum that stresses good health habits and awareness of communicable diseases and their prevention, and the importance of maintaining healthy bodies and minds by abstaining from the use of alcohol, tobacco, and controlled substances. Our policy has evolved to the establishment of education programs that address prevention of substance abuse, and I think one of the areas that I'm sure was just an oversight but is incredibly important when it comes to the mental health side is effective youth suicide prevention programs. Those have become incredibly important on our campuses. That's how we operate internally. And if many of you know teachers, you know their day begins very early in the morning and ends very late in the day. But because of the importance of this issue, we as an organization started in 2002 with a program called Teachers for Healthy Kids. It was an endowment, California Endowment funded it. And what we did was create a link between student health and learning through our own internal member education with our own local associations, the districts, and state interventions by promoting the enrollment of eligible children in no or low-cost health insurance programs. And that's been incredibly effective. We still have a problem with individuals who don't know of the existence, don't know of their eligibility. Campus by campus, we are sort of working our way through 1,000 districts in the state of California. In 2006, the California Endowment also funded for us a Healthy Air, Healthy Kids, an outreach program to improve indoor air quality, which we've heard about because of the asthma triggers in schools through school site interventions and district policy changes. And again, that's an issue that affects not only the students in the classroom, but the teachers in that classroom as well. Our last activity, our most recent one, is Healthy Bodies, Healthy Minds, where we try and are assisting our teachers in providing them materials to recognize how student absences are closely linked to health-related issues such as asthma and allergies, severely overweight children, and the need to address physical activity and provide healthy choices for students. I'll wrap up there. Several people in this room sat for a couple of days, I think it was in 2006 or 7, for about 3 days in a room full of about 100 people and talking about the expansion of school health centers and clinics and how the governor at that point had expected to be able to fund 500 new programs, which of course has not happened. But on behalf of our organization, we are incredibly supportive of school health-based clinics and the importance that they provide to the community and to the student population. Thank you.
Good morning, everyone. I'm Serena Clayton, and I'm the director of the California School Health Centers Association. Our organization focuses on promoting school-based health centers as one of the solutions to the issues that Claire and Greg talked about in their presentation. There are 153 school-based health centers in California, and I'm very excited that Hiram Johnson will soon make that 154 in a week or two. I did want to just comment on their experience with taking 9 years to start the school-based health center. That's a little bit longer than the average, but I have to say it's not completely out of the range of the time it takes to start a school-based health center, and I think that's something that I just want to put on the table in terms of when we look at policy options to be thinking about how to make education support services and school health services more accessible and more the norm as opposed to the exception. We really need to be looking at the barriers and what is it that makes it take 9 years to do something that, you know, when you listen to Pauline talk, it seems like the obvious choice, and yet it took 9 years to actually get the funding and the partnerships together to make this happen. So we primarily have focused on school-based health centers, which is a very comprehensive solution in the sense that it involves putting medical practitioners on a campus to actually deliver health care in schools. At the same time, I want to really acknowledge that school-based health centers are just one of the many strategies that I think we need to be looking at when we talk about what is our response to ensuring that all students are healthy and ready to learn. There's a whole range of school-based health and support services, school nursing, school mental health programs. There are mobile vans that deliver asthma care, vision care, oral health services. There's a lot of oral health prevention, fluoride varnish, sealants. All of this should be done in schools. Nutrition services and nutrition programs, things that foster healthy school environment. So I know that a lot of my colleagues who work on these issues are out in the audience, and I hope that you will come up during the comment period and just talk about what you do so that we can begin to think about how do we, there's no one size fits all for every school, and we need to think about how are we going to create a set of policies that allows schools to implement options that work for their school. And I just want to say, the last thing I want to say is that our field is very fragmented, and it's very frustrating to me because I feel like there's a lot of people in this room and outside of this room who are doing similar things, but we use different language. We all know each other and like each other. It's not that there's necessarily tension or rivalry, but we don't really do a very good job of talking about what we do in a way that people understand it and that people have sort of concepts about what school health and support services are. And Greg even alluded to, he said that he's using the term education supports. You might have heard the term learning supports. We talk about pupil services. We talk about school health, integrated support services. In California, we had Healthy Start. We talk about student assistance programs. We talk about family resource centers. Some people even call this soft services, meaning not instruction, but sort of everything else that wraps around it. And so I feel like one of the challenges and one of the things that I'm really excited about that perhaps will come out of this work with the Select Committee and the work that the endowment is doing is that we will be able to come together, have a little bit more common language and common concepts so that all of this work that we're all doing, which is essentially all towards the same goal, will have a little bit more visibility and we'll be able to move that work forward in the policy arena. Thank you.
So with that, we wanted to open up the mic if there are folks who wanted to add any particular perspective on an area of work in this arena, or if you have questions for the panel. So the mics here are live if you wanted to come up to one of the two chairs here. And if you're wanting to make a comment, we do ask that you please try to limit it to 1 minute each so that there's time for everyone who wants to contribute who can. And then our panelists will, of course, try to answer your questions as best as they can as well. Thank you. And at the very end, I'm just going to let folks know, I'm going to let folks know when we get close to noon so that we can do a quick wrap-up. So thank you very much.
Good morning. I'm Nancy Spradling from the California School Nurses Organization. I'm the executive director. And thank you very much, Serena, especially for making that statement, because I think that there is a tendency to sort of oversimplify a lot of these issues, and there are those, especially in the education community, who think that, well, school-based health centers will solve our problems, so now we don't need school nurses. We hear that a lot. Just as a reminder that the role of the credentialed school nurse for many years was to be the supervisor of health on a school campus. This person is the licensed healthcare professional who also has a credential that allows them to function in the education setting. It was created to be an intermediary between student, parents, physician, and the school. Many school nurses are also charged with the supervision of unlicensed staff who provide a lot of services on school campuses. And really, it's only the credentialed school nurse who has that authority. School-based health centers are wonderful, but they don't deal with those aspects of school life. Both school nurses and the health centers are vital, absolutely vital, to provide the safe and appropriate care and services that our kids need. Basically, all kids should have access to school nurses, and the school-based health centers are there to provide this further services that many of these kids need that the school nurse cannot provide. And just want to mention one more thing before you cut me off, that $677 million that is lost every year, that would basically, along with the nurses that we currently have, would put a school nurse on every campus. Thank you.
Thank you, Nancy. Good morning. I'm Dr. Sherry Coburn, and I'm the Northern Section President for the California School Nurses Organization. And Greg, I just want to tell you, you did an outstanding job with your presentation. And Claire, thank you so much for your support of school services. And I agree with Serena, we really do need to come together because it is about kids, my kids too. So I just want to highlight what the research says with respect to school nurses and their contributions in promoting academic success, because as Greg pointed out, there is not a lot of research, but there is some. And so I think it's really important to take a look at that. And I really believe in coordinated school health. I'm probably going to go over in a minute, so I'm sorry. I just want to highlight that the National Health Interviews Survey shows that children who have poor health are 11 times more likely to miss school. And so, you know, as a principal, you understand that. And there's an inverse relationship between absenteeism and academic performance. On the second page, in order to continue to prove achievement, attention must be directed towards removing health barriers. And so I really appreciate the California Endowment's approach to that, because you've recognized that. That is so critical. 1 in 4 children is at risk for academic failure because of their health. And then I just continue on with some studies highlighting that school nurses, the presence of school nurses in school systems, actually showed a reduction of children that had to leave early. We've worked in our own county with the American Lung Association in getting spacers for children that are asthmatics, and we have seen remarkable improvements in student attendance rates as a result of that. It's a great partnership because, you know, kids that don't have those spacers for asthma, the medication delivery becomes complex, and it's really actually ineffective. If physicians will tell you that. Ma found that school nursing interventions targeted students with histories of high rates of absenteeism actually decreased the number of days that they were absent. So when you had the school nurse intervention, when I was a practicing school nurse, we used to go do home visits with the police officers on chronically ill students, asthmatics, diabetes, or whatever. Home visits, Lathrop, California, high poverty, high Hispanic, lot of barriers, but we saw actually attendance improve after home visits intervention, because they knew that if they didn't get to school, the cop was going to pick them up and take them to the school site, and they didn't want to arrive in the cop car in that. Chown found that better health status enhanced children's learning capacity and student achievement. Cooper reported that sufficient health services were available. There was an increase in student attendance and graduation rates, as well as a decrease in dropout rates, and that's the goal of all of us. There was a study in Mississippi that showed that when a district hired a full-time school nurse, as well as other elements of coordinated school health, inclusive of mental health counselors, that their test scores improved on second graders. Wyman found that fewer students left early because of injury when there was school nurse interventions. School nurse interventions, including hand washing, have reduced absenteeism and illnesses. They also found that school nurse interventions were able to rectify issues that hampered educational processes. I think it's really important to note when you're talking about health services and access that oftentimes school nurses are the only health services access that children have. I know in our South Stockton schools, they do have issues. 15% of all parents reported receiving their primary health information from a school nurse. And then I've just provided you a copy of all of the services that school nurses provide, outlining the credentialing requirements of school nurses, an article that was written by Dr. Howard Terrace. He was on the Committee of School Health for the American Academy of Pediatrics that talks about school health services, and then some literature resources outlining research-based substantiating practices of school nurses. Thank you so much.
I'm Catherine Scott. I'm Director of Physical Education at the University of California, Berkeley, and I'm a member of the California Task Force on Youth and Workplace Wellness. I thank you for your report. but I'm passionate about my particular field, and I think that there's a little bit lacking in the sense of recognition of physical education primarily and physical activity in the importance of combating some of these mental, behavioral, and academic problems. And I would encourage you to really look more deeply into utilizing those types of things. The other thing I would caution you on is physical education, physical activity, and physical fitness are not synonymous terms. You need to have the education, the physical education, teaching children how to move and how to move properly so that they can then enjoy recreation, after-school activities. Children don't know how to play. They aren't encouraged to play. They don't have the opportunity. And yet in the schools, particularly at the younger ages, if you give them those opportunities, then you can begin to encourage them to continue into lifelong healthy activities. Calories in, need calories out. And so we need to get them from not being sedentary type of young people. I would like to invite you to come on January 20th to a hearing in this room with the Wellness Task Force, because we are going to have a hearing regarding the response outcomes from our PERC project. PERC is Physical Education Research for Kids, and we have been doing focus and study groups, and there will be a hearing giving some policy recommendations based on physical education. So that will be on January 20th. Thank you.
Hi, my name is Deborah Moore, and I'm the Executive Director of the Green Schools Initiative based in Berkeley, California. We work with K-12 schools across the state on a variety of environmental health and sustainability issues, including indoor air quality. And we're part of a collaboration with the California Teachers Association, the Environmental Working Group, Coalition for Clean Air, Regional Asthma Management and Prevention Initiative to focus on how to improve indoor air quality and reduce asthma. And while this may sound like a very narrow technical issue, I want to bring up to everyone here that we want to focus on prevention. And while treatment and inhalers and spacers and all of that is really important, we don't want kids and teachers to get asthma in the first place. And one way to do that is to help get toxic chemicals out of schools. And another way, even more narrow, to do that is to get schools to switch to green cleaning products. And there's a bill pending in the California Assembly now called the Clean and Healthy Schools Act, AB 821, that is co-authored by, that's authored by Julia Brownlee, the chair of the Education Committee. And this bill would require schools to use less toxic cleaning products as long as they don't cost more. And 8 other states have passed similar laws, and what those states are finding is that switching to green products saves the schools money, improves attendance, and reduces asthma rates, because we now have a growing body of research showing that the chemicals in conventional cleaning products cause cancer, cause asthma, reproductive harm, central nervous system damage. And since we've got other alternatives out there, hundreds of products that are widely available from mainstream manufacturers, why? Why should we use the toxic stuff around our kids? So we held a policy briefing November 5th, not in this room, but in a different room. And I don't have enough for everybody, but I have a few copies of some information about the bill and policies in other states, and some research that the Environmental Working Group just released about the toxic chemicals and cleaning products that are used in California schools. So it's a narrow issue, but we want to focus on prevention, and we think it very much supports and is a very tangible thing that schools can do to support improving the school environment and student health. So, does anyone want one?
Hello, I'm Dr. Sheila Holcomb. I'm a practicing school nurse and a nursing educator at Sac State. I have worked as a school nurse for 18 years in the 3 largest districts in Sacramento County, or except Elk Grove. what I'm here to say is that school nursing does an aspect of healthcare for students that no one else provides. We do triage, which can be through screening for vision, hearing, scoliosis, dental screening, to find students who don't have services, to find students who do have needs and get them to that center or to that clinic or to whatever resource is necessary for them. We were frontline with H1N1. We were very familiar with it in May, and we became more familiar with it in August and September of this year. We follow communicable diseases. We track. We do teaching to our staff. We do teaching to our district. We do teaching to parents, including students at our sites on how to maintain wellness. We work closely with the public health office to report and coordinate when we start seeing something, so that they can also decide whether they need to track and send out more information regarding surveillance and monitoring. Another area that has always been an issue and a passion for me that school nurses do is watch students for safety and for child abuse. We see and hear students in a way that teachers don't. Lots of times they come to our office with a stomachache, and most people think, what did you eat for lunch? Well, we ask that question, but we also ask, how are you doing? How's your, classes going? How are things going? What do you do after school? And oftentimes you'll find there are other reasons that bring them to our office. It may be from a fight at the house the night before. It may be from injuries. I had one young boy who came in with a blunt force trauma to his abdomen when his dad, struck him. So we call CPS. We work with CPS. We follow foster children. I just referred a foster child who came to me for a triennial, which is a special education process where there's every 3 years a report. This student had termed out in foster care, but she was still available for services and attending at 19 years old. The student weighed 67.6 pounds. I contacted her guardian, who she was now living with again, and that to have her seen by her doctor, who she had not seen in almost a year. This child is now receiving excellent care in a wonderful facility in the Bay Area. My hope is that she'll be able to come back to school, and I've talked to the social worker twice already this week. So we see children in a different way. We also, as Sherry mentioned, see children for attendance issues, because it's okay to stay home if you're sick, but not for 18 days. If you're that sick, you're in the hospital, or at least you've seen the doctor. Many of these students don't see the doctor. Mom's working, dad's working, they're gone to work before the kids even, get up and get off to school. Sometimes I'll ask, well, did you tell your mom this morning? No, I didn't see her. Did you have breakfast? Well, I was late to the lunchroom. The issues are there. They're issues that we see up close and work with. And I would ask that you give serious consideration to that role and that unique opportunity that students have, that parents have, and that what school nurses offer to school health. And ask for your support with that. Thank you.
Good morning. My name's Patty Mancuso, and the prior 16 years I was a practicing credentialed school nurse in Redding, California. Currently, I am the California Director to the National Association of School Nurses. And initially, when the white paper came out, I was very excited to see the information. And as I ran through it, I was thinking, where's the missing link? The missing link. And you've heard from a lot of school nurses, so you've heard that. But as we listen to the panel today, I think we have heard that. I think people do recognize that point. So I'll keep mine really brief. A lot of people before me have said excellent points. I just want you to know school nurses want to be at the table. We want to be talked to. Sheila just mentioned very, very well that school nurses do a lot more than just put Band-Aids on. In fact, I don't know how many Band-Aids in 16 years, maybe 2 or 3 I put on. That wasn't my role as a school nurse. And so one thing I think Ceci said, Echevarria, is that how you say your name? She mentioned that the California Endowment felt that all children should be healthy, safe, and ready to learn. And so now I want to share with you California School Nurses Organization vision statement. The California School Nurses Organization believes all children should be in school, healthy, ready, and able to learn. So we are all on the same page, you guys. I mean, that just struck me. So Another person to get a hold of and talk to is Dr. Howard Terrace, who is on the Council for School Health. He also consults for San Diego City School District. He gets it. He knows what's going on. So I would really encourage you to talk to him too. Thank you very much.
Good morning. I'm Mary Marks, Dr. Mary Marks, and I am the School Health Education Consultant at the Department of Education. And I want to ditto everything that was shared today in terms of the research. It's really nice to see the research actually getting some visibility, and congratulate my colleagues in Sacramento City for a health education center. As I sat this morning, it struck me about schools and what their purpose is. And the purpose of schools is clearly an academic mission. And what I didn't hear today, and what I want to bring to your attention, is I didn't hear where students learn about health. I didn't hear any of that. And absolutely we need school nurses, and we need school health centers, and we need community bases. We need a coordinated approach, and Serena is so correct. We need to work together and for a common purpose. But I really want to hear about where kids are going to learn about healthy behaviors. And I've been at the Department of Education now 4 years, and every day in 2009, I get emails and phone calls. Not one day goes by where I don't have a school superintendent or a school principal call me and say, I don't have money, I'm going to cut health education or physical education. Tell me how I can do it legally. That is a horrible question if you work at the Department of Education. And what I hear from superintendents and principals is, I don't want to do this, but I don't have a choice. And so what I would say is, we do in California what we're held accountable for. And we are not holding our schools and our decision makers accountable for the health and well-being of students in California, period. Because if a superintendent or a principal is allowed to fire the school nurse, to cut health education, we have one institution of higher learning left in California that has a health education credential program, and it is on life support, and that's Long Beach. I'm 57 years old, and when I went to school, I had a school nurse, I had a physical education program, I had a health education program, and I want what I had for this generation of kids. Physical education classes in California are averaging at the high school level above 50 students in a class. In my mind, that's child abuse, and there isn't any learning. And a child who weighs 350 pounds in a physical education class with over 50 kids is not going to get the experience that they need. So I would like to challenge this committee and others that go around, I hope we're all working together, is please put health education on the table as part of the research you present, because what you will find is it's on life support. And I would also challenge you to think about physical education, because the mission of schools is about education, and health and physical education, and all that encompasses in a very comprehensive approach is core content and core. And we have to talk about it. We have to say, we are in trouble. We are in life support. Because when we're spending $100,000 a year on our men and women in prison and less than $10,000 a year on our future, we're upside down. And we have a unique opportunity right now with all the budget property. We can look at it as an obstacle, but we can also look at it as an important time to dialogue about, are we going to make a difference with this generation of kids, and are we going to work together, and is everything going to be on the table? School nurses, physical education, health education, school health centers, community-based centers. It's all got to be there, and I'd like to challenge you, and I'm certainly willing to help with this problem. Thank you.
Just a quick note to folks, because there are still a few more folks who do want to speak, and everyone has incredibly excellent points to make. To please try to limit it to a minute so we can fit everyone in who's interested. Thank you.
Okay. Hi. Thank you so much for the presentation today. My name is Jen Weiss, and I'm from Team Up for Youth, and we're an intermediary organization based in Oakland that has worked in the Bay Area for the last 10 years, and we're now expanding statewide. And we advocate for and ensure that low-income kids get access to quality sports programs and skilled and caring coaches. And one reason we know that that's so important as middle-income parents who shuffle their kids to Little League and AYSO soccer games every weekend, and their schools have generally decent sports programs. What we know in low-income communities is that that's just absolutely not the case. Kids do not play sports on the weekends. The schools, as you know, have cut many of their sports programs, including PE. And so we've partnered with both schools and community-based organizations to ensure that they offer quality sports programs from a range of sports, more traditional to non-traditional yoga and martial arts, so that every kind of child gets access to a sports opportunity, but also, and more importantly, to a caring coach. And the presentation referred a lot to the role of teachers and the role of nurses, but I think we also should think about the role that coaches can play and in creating a sense of well-being and school connectedness. And we just released a paper called Learning to Play, which I'll leave with each of you. And it outlines the important impact that sports and organized sports and coaches can have on educational outcomes. And we're just about to release our second paper on sports impact on health. And would love to have you involved in future efforts that we undertake to make sure that kids in low-income communities and schools get access to good sports and really good coaches. So thank you.
And thank you. Since I have 1 minute, I'm going to keep that as tight as I can. I'm going to just say thanks to everyone rather than individually. It's an amazing group of folks here. My name is Tim Keenan. I come here today as a parent. That's my primary role. I am also a nurse, not a school nurse, an ICU nurse, currently at UCSF, where Claire is at as well. But I come here in some ways representing also the Healthy Eating, Active Living Collaborative, because as a parent volunteer, they've supported me in my work at my public school in Sacramento City Unified School District. I applaud your efforts and your work. I'd just like to offer a couple of challenges as you move forward, and I think the audience has offered a few more, and I know you're all working, and I do feel we're all on the same page, and we're working hard to break down those silos. So I'll thank Assemblymember Torlakson for that effort. A couple challenges, after-school programs. I mentioned that. I don't hear that here, but I do think that that's important to consider if we're going to leverage in this time of economic difficulties and also to create that connectiveness that we know we're all after for our children. I am a father myself of a 7 and 8-year-old, and I know that their classmates are often challenged as I see them in the schoolyard when I bring them into school in the mornings. Also community engagement for those after-school programs, but in other ways. One of the challenges that I've seen and that I'm working to try to address and understand are the live scan process. I know it's vitally important that our children are cared for by people who we know where these people are from and that we can track them down if we need to, if there's some concerns on a campus. So live scan is vitally important, but unfortunately it creates a problem for many who would like to work in their churches, work in their organizations such as 4-H or Boy Scouts, and also work on their school campuses in a variety of areas. They have to get live scan for each and every one of those, and that's a huge cost for those who might most be willing and able to spend their time instead of their dime taking care of our kids. The couple of other challenges, I know that the RN challenges, that's very important. We lost our school nurse. Last year, she had 7 schools. This year, we have no school nurse at our elementary school. And the last thing that I would say is that I would ask, when we look at these community-based or these school programs that are community health centers, as you, Pauline, and you, Serena, are working on, are there models where that would expand out, not just for the students, but for the communities which support them? Because we know that that's vitally important. Can we provide the health and the health education and the financial support and the community support to provide that? Thank you.
Hi, thank you. I'm Dr. Diane Baker. I'm coordinator of the school nurse program at Sacramento State that issues the credentials for school nursing. This has afforded me the opportunity to visit campuses from Santa Barbara all the way up to Eureka and look at their health programs in detail over the last several years. A couple of things I consistently find, and I'd like you to consider, is that school nursing is, of course, much more effective when the National Association of School Nurse Standard is met. That is one school nurse for every 750 students, and the ratio, of course, being lower for special education students. But some models that I've seen that have been particularly effective have been when the school nurse has also obtained their STA credential. It's a specialized teaching authorization in health. And that allows the school nurse to be the health educator, issue a grade, and actually be in the classroom. I have many school nurses that have done both those credentials, and it's a very effective, good bang for your buck kind of model, and I would like to see much more promotion of that. Currently, right now in California, there are only two places to get that credential. Sacramento State happens to be one, but we're facing barriers and cutbacks within our own program at Sacramento State, which are limiting our ability to even offer that supplemental credential. So I'd like you to take that into consideration. The other thing is the credentialing program within the state of California for school nursing. The CSU campuses are under huge fiscal and financial distress. And as a result of that, they're demanding that our classes be quite high. And we currently don't have necessarily the volume to put 40 students in a graduate course when the previous standard used to be 20. And we're under threat of closing our program. We are the only credential program in Northern California that school nurses can go to. So you're talking about not only not having enough school nurses in the schools, but also no way to actually get them there. So as you're moving forward with your advocacy, please, please keep that in mind. The third thing is, can there be a school nurse in every school? Absolutely, and there are national models I'd like you to look at, particularly the state of Iowa, where they have legislated a school nurse in every single school. Their absentee, their health rates, their test scores, everything got better when they did that. So I encourage you, let's get a school nurse in every school. Let's work in these partnerships, and I commend you for bringing this issue forward. It's been way overdue, and way to go, Pauline. I've been with her a long way during this journey, and you rock. Thank you.
Good morning. I'm Crystal Moreno-Lee here on behalf of Children Now. My boss, Wilma Chan, could not be here today. She unfortunately had a conflict, and so we just wanted to say a few words on the work that Children Now is doing. We're a policy research advocacy organization, and we currently work on health education policy, obesity, and more recently, children's oral health. We are also looking to develop some policy strategies in terms of integrated services, particularly in school settings, and recently actually convened an education and oral health convening last month to really bring together experts from both sides to brainstorm and collaborate around setting the policy agenda on children's oral health in school settings for 2010. And Nurse Tracy was a part of that convening, and I'm glad to see you here today. We really believe at Children Now that it's important that we include those in direct service in our conversations as we're looking to form and inform policy setting. I'm also here as a parent. I have two children, both who are in Sac City Unified School District. One of my children has special needs. And so when we talk about student health and related to performance, I know that firsthand. You know, my child was never supposed to walk or talk, never supposed to, be in mainstream school. And I firmly believe the resources that we were able to tap into, making the connections within the school district and the teachers and the schools that we've been in have really made a difference in her life. And so we look forward to really furthering our collaboration on this numerous fronts with all of you, any and all of you. And Nurse Tracy, my offer still stands as far as volunteering at Hiram Johnson in your clinic. And congratulations.
Thank you, everyone, for your comments and your interest in these issues. So I just wanted to follow up. Again, I'm Ceci with the California Endowment on the next steps for this project. So we heard feedback after the legislative forum that we held in Los Angeles. Some similar comments, I think, emerged as what we've heard today. We'll be taking those comments and that feedback and sort of putting it into the mix over here as the various components of the project that remain get underway. And those include the development of 12 to 14 issue briefs on specific topics, I think many of which were mentioned today. Potentially will be developed over the next 12 to 24 months. The main focus of those issue briefs will be to, again, get a little bit deeper on some of the specific issues. We'll be looking at policy recommendations at the state level largely, and also considering local implications, policy, and practice as well. We will be continuing our work with the Select Committee and their interest in these issues to help have public conversations and discussions about those issue briefs as they get developed. So we will continue to solicit your input and your feedback on these as we move forward with the various components of the project that remain. So Erin's asked me to make a few announcements, though. We'd love folks' emails to continue to keep you up to date on the remaining components of the work. There's a sign-up sheet in the back, in the entryway in the back. If folks want to, please provide your emails for ongoing updates. I just want to reiterate, this is the first step in the next 24 months that we're looking at in terms of pulling the issue briefs together. So we thank you in your interest and in making sure to spur on our activities in this important area. And also feel free to leave your cards if you'd like us to have access to other sources of your info moving forward. But on behalf of the California Endowment and of the Select Committee, we thank you for your interest and for attending.
Make one announcement. Sorry. I just want to remind you that we do open our clinic next week on Wednesday, and I would like to invite all of you to attend. We have some invitations up front, so please feel free to take one of those. We look forward to seeing you and having you visit our campus beyond just the opening school. Thank you.
And I have one more thing to say. I feel like a little bit about the guy who wins the Academy Award and forgets to credit his wife. There's another partner in this process, and that's the Learning Supports Division of the California Department of Ed. And they have been behind the California Healthy Kids Survey and the California School Climate Survey. And their commitment has been to provide the data that we can have to discuss about these issues and really talk about accountability and the connections between health and education. So I see all my friends out there. So I wanted to give them credit and really acknowledge that they're there to help in this effort. Thank you.